Welcome, 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 everyone. Thank you for joining in. I am Daddy Fidel. Hello. Bankuli. It's so good to see you. Hello. Thank you for joining in. So, welcome to another edition of Life's Journey. My name is Benedicta Elichi, and this is Life's Journey. You are watching Life's Journey. Life Journey is a YouTube series I started some weeks back. And what is the aim? The aim of this series is for us to get together and tell our stories in such a manner that we learn by listening. By sharing our stories, we get solutions to old age challenges and forge ahead in life. We're going to be helping each other to forge ahead in our life journey by sharing our stories, one story at a time. So welcome to Life's Journey. If you haven't subscribed to this YouTube channel, it is youtube.com/Tastebudzng. And you are watching Life's Journey. So welcome. Victoria Agari, hello. Thank you for joining in. So today's topic, what inspired today's topic? I had series of DMs and WhatsApp messages on our Life's Journey phone line. Women that went through PTSD, post-traumatic stress disorder, after childbirth. So I had some share their stories with me, but they were too shy to come on to join in today. So I'm not going to be mentioning their names, but I felt that if a lot of women are actually going through this in silence and they have no one to talk to, it is something we should discuss. It is something we should talk about. It's a conversation that we should have. So that's what inspired my topic for today: surviving difficult or traumatic birth experience. So how do you know you're a victim or you're suffering from PTSD, which is post-traumatic stress disorder? Or just to cut it short, how do you know you are traumatized from your birthing experience? The signs to look out for. Thank you. Yeah, I know you missed last week's. Oh yeah, thank you, thank you, thank you. Thank you for joining in. So how do you know you're suffering from post-traumatic stress disorder? The signs to look out for, or rather, before we talk about the signs to look out for, why do people go through post-traumatic stress disorder? What are the events that might take place prior to this? You see, one thing with being pregnant is this: you don't know what to expect. Like with each and every pregnancy, it is different. We can't really determine what the outcome of each pregnancy is going to be like. So naturally, there is anxiety in every expectant mom. I have 5 children, so I've been pregnant so many times. I've gone through normal delivery. I've gone through emergency cesarean section. So I know what it can be like. I know what it's like to suffer from PTSD. And I want to tell all the women out there that have gone through it that you are not alone. Some can be chronic. Some can last for a prolonged period of time, let's say 6 months and above. It is nothing, I wouldn't say it is nothing for you to worry about, but it is nothing that cannot be solved. It is nothing that cannot be solved. So by us coming together to talk about it, to listen to different solutions on how we can overcome PTSD, it will do us a world of good. So now let me start by telling us some of the reasons that can bring about post-traumatic stress disorder. If you are pregnant and you happen to have an emergency C-section, a C-section resulting from complications, a C-section that wasn't pre-planned. Some of us opt to have C-section naturally. From the time of conception, we have discussed with our gynecologist that we would like to have C-section. Those are not the people I'm talking about. I'm talking about people that went in for an emergency C-section arising from one complication or the other. People that have gone through such an emergency C-section have the tendency to suffer from post-traumatic stress disorder. Now, those that also suffer from neonatal death situation, people that women that have that lose their babies within the first 30 days of life can also suffer from PTSD. Women that have stillbirths can also suffer from PTSD. And women that do not have emotional support post-delivery can suffer from PTSD. If you've had a baby or you have a child and you do not have the love and support of your loved ones around you, that can also lead you into depression. So these are some of the signs, or rather these are some of the circumstances that can lead one into suffering from PTSD. So if you now know you are suffering from PTSD, how do you know you're suffering from PTSD? There was a lady that sent me a WhatsApp message. She said she has a 3-month-old baby and she doesn't know, this is her first baby. She doesn't know what is wrong with her. She's often crying. She finds herself crying all the time. She isn't happy. And I asked her one question. I said, why are you not happy? And she said her husband has been talking her down since she got home from the clinic because she had a baby girl. The husband was looking forward to having a male child, and I was really surprised. We're in 2020. This is 2020. This is her first baby. It's not like she's had previous children and they were all female. This is her very first child. And this woman is having it really rough because she had a baby girl. So that is a clear case of a situation that can lead one into suffering from post-traumatic stress disorder. When you are a new mom and you have no love and support from the people that primarily should love you, people primarily that should celebrate your delivery with you, they are not showing you love, they're not showing you support, they talk you down, they don't listen to you, you don't have a say in the decision making when it comes to medical procedures concerning your new baby or medical procedures concerning yourself as a mom. All of this can lead to post-traumatic stress disorder. So I tried to tell her that she wasn't alone, and if she wasn't getting the love, attention, and support that she needed from her husband, she should try talking to her mom, a best friend, a relative, someone that she holds dear, that she can confide in. And if possible, she can summon a family meeting. Yes, she can. She can summon a family meeting and have the husband's family members talk to him. Because in situations like this, women can become suicidal. One thing we should know is that our endurance threshold varies. My endurance threshold varies from your endurance threshold. So you don't know how much people can actually take before the snap. So what are the signs to look out for when you're not sure if you're a victim of post-traumatic stress disorder. One is anxiety. Sorry, power supply just went out. Niger, we hail thee. But don't worry, it's going to come back real soon. It's going to come back real soon, okay. Yay! My estate rocks. So, we're back on. What are the signs to look out for in order for you to know that you might be going through PTSD? One is anxiety. You're always anxious, you're always jumpy, you have nightmares, you have flashbacks, you're usually sad. Like the lady I was just talking about, she finds herself crying all the time. She cries for everything and anything. That is a sign of someone that is suffering from post-traumatic stress disorder. It is not a matter to take lightly. I had two terrible, horrible, horrific birthing experience that almost claimed my life and the lives of my children. Both children that I had with the emergency cesarean section that I had to go through. It was life-threatening. I almost lost my life, but thank God I'm alive today. So I can understand when women say they are going through post-traumatic stress disorder. I know what it's like. My first emergency cesarean section I had with my third child, I actually lost my vision. I couldn't see. I was blind for about almost an hour plus. I lost count of the minutes. I had ER, the paramedics were with me, but I lost my vision. I couldn't see. I was just holding my baby. I was cradling my baby. She was about 3 weeks old because she was just discharged from the intensive care unit. That is another thing that can put any mother into a roller coaster of emotions. When you have a baby that is in a neonatal ward or in an intensive care unit, and every day there is a new test to be run. It's either they are doing the brain function test, they are doing the hearing function test, they are not sure if the baby is going to be is going to suffer from Down syndrome. They're not sure if the baby is going to be autistic. They are not sure if the baby is going to be confirmed as an A+. That's a fit baby. So every day you're sitting on your hospital bed, you're on the edge. With each doctor that comes into your hospital room or with each nurse that walks in, your heart starts beating really fast. And there's nothing you can do to stop it. It's enough to run any new mom crazy. Like I said, our threshold for pain, our endurance threshold varies. I was very strong, or rather I think I was very strong because I didn't lose it completely, but I was almost a nervous wreck. I found myself crying every second. I found myself praying every second. I was meditating every second. I couldn't eat. I couldn't sleep. Each time I tried to sleep, I had flashback. I had nightmares of what could have been and what might be. So it's a horrific experience. So if you know anyone around you that is going through post-traumatic stress disorder, please encourage her to seek medical help as quickly as possible. She might need to see a psychotherapist. She might need to see her GP for her to be placed on some sort of antidepressants. It is not something to joke with. PTSD has resulted in so many new moms taking their own lives, in so many new moms murdering their newborn children. In so many new moms acting irrationally. You might take out your anger, your pain, your frustration on a loved one that hasn't done anything to deserve it. So if you happen to be around a new mom, maybe you're a dad, you're a new dad, or you happen to be the mother of a new mom, like a grandmom, do everything in your bid, everything in your power to ensure that your child is emotionally stable, is mentally stable. It is not just enough to look at a smiley face or look at a new mom with a smiley face and assume everything is all right. Find out from them. Ask them, talk to them. Are you okay? Are you all right? Are you sure you're all right? Can I help you with the baby? You need to take some rest. Because sometimes when new moms feel like they're no longer in control of their lives, they've lost control, they're aching from lactating, they are waking up at odd hours to feed a new baby, the baby is screaming non-stop, they are in pains all over, and there is no help coming from anywhere. It is enough. It is enough to send them in that downward spiral. And if you are a mom-in-law, because you see, the funny thing with Nigeria is this: when you have a baby, 90% of the time when your mom comes around, you can order your mom around, you can boss her around. Mommy, I don't want this. Mommy, I don't want that. Mommy, just do this. Mommy, do that. But when it is your mom-in-law, the reverse is the case. Sometimes these mom-in-laws can be so demanding, forgetting that you're a new mom. That is when they remember that they need hot water to take a bath. That is when they remember they have to eat a particular meal at a particular time. Forgetting that as a new mom, you should be the one on the receiving end. You should be the one they should be pampering. And women are often put in this box that they have to impress their mom-in-laws. Listen, if you're a new mom, this is not the time to impress your mother-in-law by doing domestic chores. This is the time for her to show you how much she loves you by taking care of you. You are the one that needs the care. So if you know your mom-in-law is aged, she's too old to assist you, it is better for her not to come around to help you with the new child or with the new baby. Because instead of her relieving you of some domestic chores or relieving you of some burden, domestic burden, she is going to be adding to it. She's going to be adding to it because she's now going to be needing you to run some errands for her, but you're a new mom. And it's unfortunate coming from their own era, they believe you can have a baby that same day and even go back to the farm. Yes, some mother-in-laws believe that you're not the first to have a child. So what's the big deal? You have a baby and I want to eat pounded yam in the afternoon and you can't give me pounded yam. So that is not the time to impress a mom-in-law or any relative around you by doing excessive domestic chores. That is the time they have to show you how much they love you by relieving you of those chores. Your health is important. If you are not alive, you cannot raise your new baby. If you're not healthy, you're not even in a position to raise your new child. So this is about you standing up for what you believe or standing up for what you know you can do and cannot do. It is not the time for you to be hypocritical and say, even if it means me dying, let me just try and pound this yam so this woman will be happy. No, you have to take care of yourself. PTSD is real. Post-traumatic stress disorder is real. Depression after childbirth is real. You might think you're doing your mother-in-law a favor by doing all those things that you know genuinely in your heart that you do not have the energy to do. And then one day you snap, and you might snap for your husband, you might snap on your child, on your new baby that hasn't done anything to you. I've heard stories of mom just dropping off a new baby because they've had it up to here. They can't take it anymore. There are demands from family members, sexual demands from the husband, and maybe you're not even ready to engage in sexual activity. Husbands, please ask your wife, is she comfortable going back to your sexual routine? If she is not, give her a break. Some women have been so traumatized, or were so traumatized during the childbirth, that they don't want to think about sex. They don't want to think about sex for a while. So if you are unfortunate that your wife is going through that, please give her a break. She needs that break. You don't want her to see sex or making love as something to hate forever, as something she doesn't want to go back to. You need to give her a break. You have to show her you love her. You have to support her by doing the things she wants you to do. I know sometimes, blackout again. Don't worry, my estate is the bomb. Oh my goodness. It's gonna come back on. So Malongzi Kumayoyi, you said most African men lack the knowledge. Yep, you're right. Most African men lack the knowledge. Men need to be informed about this. You're right. Men need to be informed about this. Honestly, I would love for men who will be fathers to just join in and listen. Your wife might be needing your support more than you know she does. Malongzi, yeah, our women suffer in silence. Yes, we do. We suffer in silence, and as a result, we snap one day and we do the dreadful. We do something that it's mind-boggling, and people begin to wonder, why did she do that? That is because she has been bottling up emotions for too long. New moms, learn not to bottle up emotions, please. Learn not to bottle up emotions. Speak out. You have a voice. Use it. Talk. Okay, you request to be on my live video. Nilo Cliff sent a request to be in your live video. Nilo Cliff, I'm going to bring you. Oh, yes. So I'm going to bring you up. So, Nilo Cliff, I'm going to bring you up in the next 1 minute. So please, women, let's learn to speak up. Stop bottling emotions. If you're a new mom, you're feeling exhausted, you're feeling used, you feel you're no longer in control of your life, you're just losing it, please speak up. If you feel overwhelmed with sexual demands from your husband, talk to him with love. Explain things to him. Let him understand that you're not yet in that mental space to restart your sexual obligations to him. And if you're a mom-in-law or your relative helping out, please be a little more patient. Do not be demanding. Expect nothing but give everything of yourself. That is the period where you can show your daughter-in-law, your sister-in-law, your sibling, just how much you love them, just how much their health means to you. I want to bring in Nuno Cliff. She requested to be... Oh, yes. Nuno Cliff, can't see you. I'm bringing you in. Nello Cliff, I'm bringing you in. Join in, go live with Cliff. So I'm just waiting for you to come in. So while we wait for Nelo Cliff to join in, we're waiting for Nelo Cliff to join in. While we wait for her to join in, I'm just going to read. I am very aware of this. Thanks for bringing this out, ma'am. I am underscore Daddy Fidel. Thank you too. Thank you so much for joining in. This is the discussion that we should be having, is a discussion that women should have. You know, I call it the glass head syndrome. If you do not speak up, you don't open your mouth to tell your husband exactly what you're feeling, or to tell the people around you exactly how you're feeling. How are they supposed to know? We are not operating a glass head syndrome. I can't see through your head to know exactly what is going on with you. You are exhausted. I might not know. You don't feel like having sex in the next 6 months or however long that is. I do not know that. You are so upset with my decision to circumcise my son. The father wants to circumcise the son, and the mother is still traumatized from the whole birth process. Like, I remember when I had my son in the States, it's the Jewish doctors that do the circumcision, but for some reason, I wasn't just ready to allow him to be circumcised. I didn't want needles, knives, or anything to touch him. It was going to break me. I was just going to cry because I was still so emotional. Everything used to make me cry then. So at that point, if I had someone insisting or forcing me or telling me, my son has to be circumcised now, it has to be now, I'm just going to break down and start crying. I don't feel like it's a medical procedure that I am not ready to have. So please, fathers, relatives, mothers, listen to a new mom. If they are concerned about a particular medical procedure that needs to be done on the new baby or on themselves, and they are not emotionally prepared for that, listen to them. Talk to them. Talk it through with them. With love, you can accomplish so much than by stamping your foot on the ground and saying, I want this now, it has to be done now. You don't do that with new moms, especially when they have gone through a very traumatic birthing experience. I really don't know why I'm unable to see Clef. We were waiting and then it went off. True, but the women need to always speak up. I mean, to tell the husband, because many of us are new fathers. Oh, yes. Dr. Sly, you're right. And that is why I am begging women, please, don't believe or don't think you have a glass head. Closed mouths don't get fed. Your husband can see through your head to know exactly what you are going through. You have to speak up. You have a voice. Use it. Speak up. Nicely, with love. I believe everything can be worked upon. Everything is negotiable. You can always compromise. Imagine how hard it is. Yes, it is. We want to listen, we want to support them, but how do we go around this when they don't speak up? Women, please speak up. Now you're seeing the guys are the ones talking. We need to help our husbands. We need to help them. We need to help them by speaking up. We need to always carry them along so that they will know where to meet us and they will know at what stage that we are in mentally, physically, post-delivery. Living on assumptions or acting based on assumptions is fatal. Don't do that to your life. Don't do that to your marriage. Don't do that. It can really affect your relationship. And I have also heard, or rather, I've experienced a situation whereby post-delivery, a friend of mine, when we were in university together, when she had her baby boy, she was mentally all right, she was okay. But guess who suffered from the birth of the baby? The husband was the one that suffered from a post-traumatic stress disorder from witnessing the birth of his son. The wife lost so much blood. He witnessed her birth the baby. She lost so much blood. He was weeping like a baby. And after the delivery, they got home. He couldn't get over it. He kind of withdrew into himself. And for months after the delivery, he didn't want to touch her. He would hug her, he would kiss her, he would cuddle her, but he was just too scared to make love to her. Yes. So sometimes men also go through post-traumatic stress disorder. It's not just a one-way thing. It's just that the ratio is greater with the women. It's like 95 to 5% or 98 to like 3%. We have that tiny fraction of men or loved ones that go through post-traumatic stress disorder by witnessing the birth of a child. So women, we should also understand that our husbands can also be traumatized from witnessing the birth of our babies. And this also calls for attention. They need your love, they need your support, they need you to constantly reassure them that you are all right. So it is not just a one-way journey. Sometimes the men themselves are the ones that are traumatized and they need your love, they need your support, they need your reassurance. Sometimes you might need a psychotherapist. You might need to go see a psychotherapist and have some sessions with a psychotherapist. Yes. It can last, the duration in which it lasts is not certain. For some people, it's a very short period. For some people, it becomes chronic. It lingers for a very long time, and they might have to resort to taking medications, antidepressants. Yes, there are some moms that their PTSD is chronic and they have to deal with it by taking antidepressants. So we have to understand the different categories, or rather the different stages of PTSD, signs to let us know that one is suffering from PTSD, and causes that might result to one suffering from PTSD. Let us look out for these signs. And I'm still trying to bring in, yeah, she requested repeatedly to join in. Mark Nalodi, if you're here, please wave your hands. I can't see you. Okay. Okay, yeah, men need to be informed about this exactly. And that is exactly what we're doing. This series is for us to have these discussions, have these conversations, learn from each other's experiences, and be better off for it. So it's not something for us to shy away from. Please, let's not shy away from this. Nello Cliff, I am trying to bring you in, but I think the network is really bad. Oh, okay. The network is really bad. So we're just going to continue. So those are the issues arising, or those are the issues that can cause PTSD. And how do you survive it? 1, seek medical advice. 2, Talk to your loved ones about it. I think the first step is to discuss it with your loved ones. Discuss it with your loved ones. Let them know exactly what you're going through. Physical assistance, listening to you talk, it's therapeutic on its own. Talking to someone that understands you. And please, if someone that is going through PTSD is talking to you or trying to explain what he or she is going through, please do not shoo them away. Don't talk them down. Don't belittle them. Don't make them feel like they are weaker women. Don't make them feel lesser of themselves. Because you haven't experienced it does not mean it doesn't exist. It exists. It is real. Women are dying from it. Homes are breaking as a result of PTSD. Relationships are breaking because of PTSD. Lack of communication. Husband not understanding what the wife is going through. The wife not being able to explain herself to her husband. So this is a topic that we all should take seriously. If you have been a mom before, you understand what I'm talking about. If you are going to be a mom, you're an intending mom or an intending father, please have this at the back of your mind. PTSD is real. We should detect it on time. We should assist patients going through it to come out of it before it becomes chronic. And if it is chronic and you need to take antidepressants, please do so. Do not shy away from it. Do not shy away from it. Our mental health is key. We owe it to ourselves to be physically, mentally, spiritually stable. Spirituality. Now, some of us are very good with meditations. You know, when we meditate, we're able to relax, we're able to take charge of situations, we're able to put things in perspective. So praying about it, it's very important. If you are in touch with your spirituality and you know how to pray, you believe in the power of prayers, please pray about it. But I do not believe in praying without seeking medical attention. No. And I do not believe in praying about it and being secretive about it. You're praying about a problem that your partner is not aware of. You're praying about a problem your husband is not aware of. You're praying about a problem your loved ones aren't even aware of. They say God works in mysterious ways. What if the key to your solution or the key to your prayer is just a listening ear from your mom or your husband? So please, let's not be foolish. Let's pray and let's work diligently into ensuring that we come out of a PTSD situation. If you have been there, you have to do everything you can to come out of it. Like I would always say, life's journey. Is your life worth living? Is it worth fighting for? If it's worth fighting for, then stop being hypocritical. Do the needful. Whatever it is you know that you have to do to maintain your mental, physical health, do it. You have a voice. Use it. So, thank you all for watching. Can't see you. Nello Cliff, I tried. I don't know, I think it has to do with the network. Kela Oniwo, my love, oh, you can't see me. Is it very dark? I think it's so dark. Everybody's complaining that they can't see me, they can't see me, they can't see me. So, can you all see me now? We need to support one another. Honestly, we have to support one another. That is why this channel is here. Thank you, Demalavi. Thank you for joining in. Looking beautiful. Thank you, thank you, thank you. I have to. Kayla, my darling, women truly need to speak up. Honestly, we truly need to speak up. We truly need to speak up. Speaking up and talking about your fears, talking about your worries, talking about your weaknesses. It's not a sign of weakness. If you're talking about things that mean something to you, it doesn't indicate in any way that you are weak. You're actually strong. It is the opposite. You're actually strong. Because for you to stand up and speak your mind, speak your truth, say it as it is, say it exactly the way you feel it, is a sign of strength and not that of weakness. When you keep quiet, it means one thing. You're weak, you're cowardly, you're scared. Oh, you're scared. Your mother-in-law might never love you anymore if you tell her you can't pound yam today. Ah, Jimirioku, Mama, Anameme, I can't do it. It's not a sign of weakness. You tell her with love, like, Mama, I'm weak, I'm tired. I can't do this today, please. I'm so tired. I need you to help me, you know? It's not a sign of weakness. It's a sign of strength. Speak up. Closed mouths don't get fed. Daddy Freeze will tell me, closed mouths don't get fed. So don't close your mouth. Open your mouth. When it's time to gist with your girls, you'll be able to do that. But when it's time to speak the truth to your mother-in-law, you're scared. Nah. That is when they show you just how much they love you. I was so lucky when I had my last baby, my goodness. I was taking fresh milk, as in fresh milk every day. My mother-in-law made sure I had cartons of fresh milk. She used to tell me that, Benedicta, when you take milk, you'll be able to bring out more milk. Take milk, my darling. Take milk, take milk. And every day I'll just cross my leg and I was just taking fresh milk because I needed to make more milk. So I just smiled to myself. I say, Kai, this is the kind of mother-in-law people should pray to have. When you're lactating, they are giving you fresh milk. They are making sure you have fresh fruits in a bowl every morning. You know, that's what you need. I think the internet is a bit, I don't know what's wrong. So guys, I'm not too internet savvy. I'm not too good with the whole online, what do you call it, live streaming and everything. But you know, I have a guru. The love of my life is a guru. So he puts me through. And sometimes I really don't know what I'm doing. Like, I don't know how to end or how to, you know, go live sometimes. Is that crazy? So he's always here to put me through. And now I really don't know what is happening with the Instagram live. I don't know what's going on with the Instagram live. But everyone is saying they can't see me, they can't see me. So what do you think is the problem? It's stalling. Okay, okay. So guys, thank you for joining in. And please remember, speak up. We do not have a glass head. So this isn't a glass head situation. No one knows exactly what you're thinking. You have to speak up. You have a voice, use it. Women, let's support each other. Husbands, please support your wives. Support them. Proud to the delivery, post-delivery, support them, show them you love them. To our mommies, we love you all. We love you so much for your love, your support, your prayers, and even when we're unable to speak out, we believe you will be able to know what's going on in our heads and just help us out. So thank you all for joining in. Thank you so much. And do enjoy the rest of your weekend. And it is bye-bye from here. My name is Benedicta Ilichi, and this is Life's Journey. Listening, supporting, educating each other, one story at a time. Bye-bye. Yes, and streaming.